Very warm welcome, friends. So please give me a thumbs up if I'm visible and audible. So just in the comment section write whether my audio and video are working fine or not. Yes, friends, anyone just do comment in the comment section that audio and video are working fine. Okay, so I think the audio and video are working fine now. Okay, so myself, Dr. Maddineni Srinivas, your dermatology educator on Unacademy platform. So in this particular 1 hour session, we are going to see the previous year questions of the NEET exam. So mainly, I will try to cover the 2020 MCQs, 2019 MCQs, and if possible, we also will see the 2018 NEET questions. So this is my profile on Unacademy. So if you are not yet, you are not yet following me on Unacademy, please do follow me on Unacademy so that you will get all the latest updates of the videos whichever I post on Unacademy as special classes which are absolutely free for everyone. And these are recall MCQ. So if at all there are any changes in the versions from what questions you have from what I have discussed, so you can feel free to put in the comment section what are the minor changes. So we shall look into that and we shall make them require any. And these are all the sessions which were actually taken as special classes on Unacademy, and these are all absolutely free. You can watch all of them. So in this almost 1 hour of complete discussion was done of the NEET questions of 2020, 2019 and 2018. And this small announcement, so there is a final bout of grand test on 4th of the September. So all of you can attend this particular grant test. It's free for everyone to attend. Just what you need to do is scan the QR code which you are able to see. So this is the QR code and you will be able to directly join this grant test. All you need to do is use the referral code DRMSD to unlock this grant test. There are many features which are available exclusively for the special class. Special class, you can attend the live classes, you can give the polls, and you can raise a hand and ask your queries, and also you can get the star learners. These are all our star learners who have secured great awesome marks. So in the FMG exam, and these were some of the other students from INSCT. These were previous FMG students. So still we are waiting for the NEET results to be announced after the exam has been conducted. So September 11th is exam date. So I will also tell few important points which you all must follow before taking this grant test. Okay. So before all this, I will try to tell you one important thing. Yes, so if you consider yourself to be this person, so this is the grant test. These are the grant tests which you might be already giving right now, or which you are planning to give. Okay, yet. Okay. And so once you start giving these grant tests, you will get a feeling that it is very, very difficult for you to give these grant tests. So you might feel it is frustrating. Then time comes when you will slowly go and you will get the flow and you will start giving these grant tests, and slowly the thing will get on smoothly. Okay, for those students who are writing this 2021, this will be very, very relatable. And finally, suddenly in the middle, what will happen? The grantors, suddenly it will appear very difficult and you will feel, why are the marks not increasing, why are they always static? And you will feel that the grantors marks, they are all actually looking at you and they are all laughing at you. Okay. But then after that, if you can analyze what are your strengths, what are your weaknesses, what are the opportunities which you are not focusing upon, and what are the, so all these, if you can analyze, so all the tension is going to reduce in the exam. Okay, so you need to do this SWOT analysis. So you need to identify what are your strengths and what are your weaknesses, and identify these weaknesses and focus on those weak areas, and try to revise these weak areas as much as possible. Because finally at the end, what will happen, I hope you might have seen this movie, so after the end there is going to be a happy ending only, definitely. But all you need to do is carry on this, carry on whatever you are doing, whatever good work you are doing, that is giving the grantors at least weekly once. Do this till the exam, and try to analyze, okay, try to identify what are the weaknesses which you need to focus on and revise more and more. Okay, that is the most important thing. So these grant tests which you are writing now, they should be considered and they should be written in a exactly exam like scenario, and also with same daily routine. That is, on the exam day, what is going to be your daily what is your going to be the routine on the exam day, the same should be the daily routine at least 3 weeks prior to the exam. So that is almost we can say from today at least you should be getting up in the morning time at the same time. Okay, otherwise what will happen, your body is not going to listen to whatever you are going to say. And on the day, if you are daily practicing that to wake up at 10 o'clock or 11 o'clock and start studying, then definitely your mind won't work in the exam hall, because the timing of the exam is from 9 o'clock. Okay, so 9 o'clock or 10 o'clock, whatever it is, so you should be prepared to face the exam, and you should also make your mind and also body well accustomed before the exam date. This is very very important. And do not break your heads really on the marks. Exact marks are not so much important of this grand test, and instead focus on the revisions. Do revisions, identify the weak areas and try to focus on your weak areas, and make your body also used to sitting for almost 3.5 to 4 hours with the mask and shield, face mask and shield. Put the face mask and shield and sit in a quiet room, away from your mobile phones, away from all the gadgets and any disturbances, and sit in a corner and try to attend exactly like in the exam scenario. Okay, exam like feeling is very very important. Otherwise what will happen, you will not get accustomed, your body and mind will not get accustomed, and finally you will feel a lot of stress and tension. Okay, that is what is going to happen. So to prevent this from happening, you need to get accustomed to the exam like feel. So for that, what you can do is definitely the grand test which is there on the 4th, which is conducted by Unacademy. Please do attempt it. Just like exam scenario, you should try to attend this. Okay, this is very very important. Despite how much ever you are preparing, if you don't make your body and mind get accustomed, then it will be very difficult in the exam day to directly attempt this thing. If you continue to think the way you have always thought, you will continue to get what you have always got. Okay, so mind your today's thoughts, for they are going to become tomorrow's reality. Okay, so always have a positive attitude. I can do it, I can do it. So, Dr. Kaustab, is it free for non plus GT? Yes, Dr. Kaustab, it is free for everyone. Everybody can attend this. Okay, everybody can attend this. And one more thing, this is actually curated by all the. This is curated by all the educators of Unacademy. Okay, this is absolutely free, and you can attend this at 9 o'clock. This is going to start. Okay, free all India grant test. Okay. Yes, now let us, yes. So I am not coming in the way. So please try to answer this in the comment section. So a patient, these are actually, you might have seen these questions. So please try to attempt them. We will have 10 to 20 seconds of time, and after that I will start explanation part of these questions. Okay. Yes, very good. Prativa Pradhan, Sahiti, Dhiravat, Kaustab, Ketre, Dokabi, Akhilesh, everyone is with the right answer. Very, very good. So a patient came with the lesions as shown in the pic, and what you are able to see near the lips, you are able to see some fluid filled lesions that are vesicles which are present on slightly reddish base when compared to the surrounding normal skin. So this is a classical picture of herpes labialis. Herpes labialis, which is usually caused by herpes simplex virus type 1. If the same picture, that is grouped vesicles, are present on erythematous base near the genitalia, then we will call them as herpes genitalis, and it is usually due to herpes simplex virus type 2. Herpes simplex virus type 2. Okay, now let us see few points about other options. So in the case of varicella zoster virus, the causative virus is varicella zoster virus, VZV, and this in the child, primary infection is going to be chickenpox. The primary infection caused by VZV is chickenpox or varicella, and these VZV varicella zoster viruses, they are going to stay dormant in the dorsal root ganglion, and during some stressful conditions they will become again reactivated, and they will produce what is called as varicella zoster, or it is also called as shingles, which is going to manifest in the form of, again, erythematous base will be there, grouped vesicles will be there, but now it is going to be the arrangement is going to be in a dermatomal pattern. The arrangement is going to be in a dermatomal pattern. That is, along a single nerve root, the lesions will be concentrated, and these lesions are going to be very, very painful. They are going to be very, very painful. Okay. And Impetigo Contagiosa is non-bullous impetigo. It is non-bullous impetigo. It is non-bullous impetigo, which can be caused due to both streptococcus as well as staphylococcus bacterial infection of the superficial layers of the epidermis. And here we can see this, honey-colored golden yellow or golden brown colored crusting, which is very, very peculiar, characteristical is in peri-orifacially. Here you can see perinasally and also peri-orally. And pemphigus vulgaris, it is a immunobullous disorder. It is an immunobullous disorder due to the antibodies produced against desmosomal protein, that is desmoglein 3 and desmoglein 1. So here we can see both oral as well as other mucosal erosions and ulcerations. Here we can see buccal and gingival erosions, and we can see vesicles which are bullae, which will be very, very flaccid. Why? Because pemphigus vulgaris is an intraepidermal blistering disorder, and because the underlying pathogenesis is acantholysis, we can see Nichols Kissin positivity. Now please try to attempt this question and answer it in the comment section. Okay, Rana K says, if desmoglein 1 involvement is there, no mucosal lesions. Yes, Dr. Rana K, that is the reason why in pemphigus foliaceus, where desmoglein 1 is the antigen against which antibodies are produced, there are no mucosal lesions. Okay, your doubt is right. Yes, now please tell me what is the answer for this question. Yes. So a 4-year unvaccinated came to OPD with fever and red eyes. Okay, so there is some red eyes. So there is some mention of conjunctivitis. Okay. On examination of the following type of the rash is seen, and you are able to see a maculopapular rash. Some macules are there and some papules are there, which are erythematous in color. So maculopapular rash is there. So if you see this kind of a question where unvaccinated child is coming with the features of fever and some conjunctivitis and maculopapular rash, most likely we need to think about measles. And in the case of measles, which is the first disease, the complication acute myocarditis has been observed. Yes, very good, Causative. This is measles, right? And we need to think about acute myocarditis in these children. Okay, and there are actually many causes for the myocarditis. So out of which few of the important ones I will just uh, try to mark here. So COVID-19 can also cause the myocarditis. Hepatitis B, hepatitis C, parvovirus B19, it can also lead. And yes, ecoviruses, Epstein-Barr virus, which can cause infectious mononucleosis, and German measles, rubella. So all of these can cause myocarditis, and even it is observed that in HIV individuals also myocarditis can be seen. There are various other causes, but in the viruses, please try to remember what all I have marked in the previous slides. And now please try to answer this very simple question. So identify the condition which is shown in the image which is associated with scaling and itching. These are the very important clues which are actually given in this question. Okay, without these clues actually it would be difficult for you to answer. Okay, right. So everyone has come up with the answer. So you are able to see a very beautiful central clearing is there. Central clearing is there, central clearing, and peripheral rim of erythema and scaling is there. Erythema, redness and scaling, redness plus scaling is there. And also in the complaints, itching is there. So it is very easy answer. It is fungal infection of the skin, that is tinea corporis. Okay, so let us see few of the other options, points which are going to be in favor of the other option. So granuloma annular, even this condition also will look like annular lesion. So you, if you see this lesion, this is also annular lesion, but at the periphery we can see beaded papules. So we can see, if the image is zoomed in, you can observe that the papules are actually beaded in nature. That is small papules will be there like this, in this fashion, if you zoom the picture. And not only that, the lesions, these annular lesions in the granuloma annulare, they are not associated with any itching. So itch and scaling, itching and scaling will be absent. So itching and scaling will not be there. And basically granuloma annulare, just remember that it is a necrobiotic disorder. It is a necrobiotic disorder. That is, there is going to be a degeneration of the collagen. Collagen degeneration will be there if we take a biopsy. So this could be a potential question. Please make a note of that. And the other option was pyoderma gangrenosum. Just remember that this is a double misnomer. This is neither a bacterial infection of the skin, neither it is a bacterial infection, nor there is going to be any gangrene in these patients. Okay, and the next point which you must know is that it is example of a neutrophilic dermatosis. That is, if you take a biopsy from this lesion, there is going to be plenty of neutrophils in the dermis. Okay, and what are the other points which you can, with which you can identify these ulcers are, so this pyoderma gangrenosum will produce ulceration most commonly over the lower legs. So lower legs are the most common site, and the characteristics of the ulcer are going to be a margin which is going to be violaceous. So violaceous margin will be there, and undermined edges will be there. Undermined edges will be there. So these are all the characteristics of ulcer which can be seen in pyoderma gangrenosum. And these are all the features which you can remember with the help of this Merry Christmas. Okay, so I am just leaving this for your reference purpose. Merry Christmas. So can you try to identify what is the answer for this, where you are able to say these linear lesions. Yes, Dr. Pratibha, it can be associated with inflammatory bowel disease. Very good, you are right. And Dr. Ranake, in diabetics, so granuloma annulare has been noted to be more likely seen in the patients who are having diabetes. Yes, okay. So there are some students who are actually giving some other answers. Okay, so reverse Kobners and Gauter's papules. Okay, so very good, Sharadraj Pillai and Pratibha. You have answered it right. Krishna Mohan, yes. So these lesions, if you observe the characteristic feature of these lesions is all of them are in a linear fashion. You can see that they are all very peculiarly having this linear pattern. So this linear pattern, if you are able to see, you should always think about isomorphic phenomenon. The total name of this is actually Kobner's isomorphic phenomenon. Kobner's isomorphic phenomenon. Okay, and Gauter's papules. So some students have answered it as Gauter's papules. Can anyone tell me? This was actually INSET question. So Gauter's papules are pathognomonic of which dermatological disease? Yes, can anyone tell? This is INSET question. So maybe you might have already listened to this. I have already taken class on this. I have discussed what are all the in INSET recall questions. So yes, any student Gauter's papules. Yes, what is that dermatological disease which will strike you when you hear this word Gauter's papules? Yes, anybody please try to answer in the comment section. Yes. Okay, yes, very good. Dermatomyositis, excellent. Dermatomyositis, very good. And Nikolsky sign, I have already told you, pemphigus vulgaris, but not only pemphigus vulgaris. Just remember, any condition where there is acantholysis as the underlying, pathogenesis, we can see Nikolsky sign. So now let us see what are all these phenomena. So Kobner's phenomenon, yes, pseudo Kobners, reverse Kobners, and remote reverse Kobners. So these are some of the terms which you must have an idea on. So Kobner's phenomenon basically describes the appearance of new lesions at of a pre-existing dermatosis on areas of cutaneous injury in otherwise healthy skin. For example, if a patient has a psoriatic lesion here, so Kobner's phenomenon, you should know that it can be seen positive in psoriasis, lichen planus, and vitiligo. Many students have already answered, very good. So it can be seen positive in psoriasis, it can be seen positive in lichen planus and vitiligo. So in these conditions, if you observe carefully, all of them have one thing in common. They are all autoimmune conditions. They are all autoimmune conditions. So if for example, a lichen planus lesion is there over here, and if the rest of the body is normal without any lesions, if we give a trauma, if we give a trauma with the blunt end of a pen over the left forearm, then after 2 weeks, if we call back the patient, there is going to be a development of lichen planus like lesion developing in a linear fashion along the trauma which we have given. This is called as Kobner's phenomenon, and this can be seen in all these conditions. So as I have already told you, and if the condition is a infection, if it is a viral infection, and if again the same lesions are being produced in a linear fashion due to the trauma which we have given, it is called as pseudo-Kobner's phenomenon. Why? Because in this, the underlying mechanism is auto-inoculation instead of the autoimmunity. It is auto-inoculation instead of autoimmunity, and this is Molluscum Contagiosum lesion which you are able to see. Yes, now please try to answer this question. Very, very important. So there are very two close differentials which you might think of. 1 second, friends. So okay, so A, no eczema. Viscott-Aldrich syndrome. Neha Naushin says option A. So many students have actually got confused with option A and B. And if you observe the question, it says recurrent infection history is given and images are being shown, and there is one important investigation finding, that is low platelets, that is thrombocytopenia. Okay, please remember, so in the pictures what you are able to see, a child is there where you are able to see some erythematous lesions over the cheeks are present, and you are able to see some eczematous lesions which are present in the folds, and these are pointing out towards eczema, that is atopic eczema, and all these are actually pointing out towards Viscott-Aldrich syndrome. So I will tell you a simple mnemonic how to remember Viscott-Aldrich syndrome, but before that, actually Job syndrome was a very close differential. If in case recurrent infection, so infection and along with that eczema, and along with that, instead of the low platelets, if the question mentioned there was a elevated IgE levels in the blood, if this was given in the question, answer would have been Job syndrome. Okay, but here our answer is Viscott-Aldrich syndrome, and just observe this name in this, instead of this spelling Aldrich, if you remember it as Aldrink, then a beautiful mnemonic is there. So we can drink water. Okay, that is the mnemonic which you need to remember. So W stands for WASP gene, WASP gene. So in this Viscott-Aldrich syndrome, there is a WASP gene mutation, and A stands for antigen presenting cells. So antigen presenting cells are defective in this condition, and T stands for thrombocytopenia, that is low platelets, and E stands for eczema. Here in this case it is atopic dermatitis, and R stands for recurrent infections. So this is the water. So drink water is a small trick with the help of which you can remember all these features. So rest of others thing, I don't think that they are very much difficult. Henox-Schönlein purpura, you all know it's a tetrad, okay, which has abdominal pain, IgA nephritis can be there, joint pain, and also palpable purpura can be there as a rash. It is also called IgA vasculitis. Very, very important to remember. Yes, now please, can you try to answer what is this answer? What is the diagnosis which you think of? There are so many clues actually. So right away, I think many of you can answer it. Okay, it is a very, very straightforward question. So immunosuppressed, immunocompromised patient, HIV patient has come with a CD4 count of 300 per cubic mm. There are some mucosal lesions in the mouth, and if you observe in the mouth, we are able to see some whitish membrane is present over the tongue, posterior aspect of the tongue, and also over the hard palate. So on microscopy, it is already mentioned that budding yeast and pseudo hyphae are there. There are so many clues. So this is a classical picture of candidiasis. And coming to other options, oral hairy leukoplakia, even this is also seen commonly in HIV individuals, and oral hairy leukoplakia, the causative virus is Epstein-Barr virus. Please remember it. The clinical features will be very difficult when compared to candidiasis. So here the white plaque usually most commonly will be seen on the lateral border of the tongue, and the if you observe the margins, they are going to be corrugated. The corrugated word can be there, or they can also mention feathery margins. So feathery margins will be there for this particular whitish block, and if you try to take a glass slide and remove this white block, then it cannot be easily rubbed off. It cannot be rubbed off, whereas in the case of candidiasis, it can be very easily rubbed off. Okay, so that is the difference between these two conditions. And in the treatment, just remember, all we need to do is treat the underlying immunocompromised state, that is give highly active antiretroviral therapy, then this particular oral hairy leukoplakia will be reduced. And this was previous question. So in the case of oral lichen planus, just remember, in the case of oral lichen planus, what we can see is this peculiar reticulate white streaks which are called as Wickham striae, and in the question there can also be a mention of triggering factor, that is amalgam, which can be used as a root canal treatment. And now please try to answer this question: which of the following drug can be used as a nail lacquer in the treatment of onychomycosis? Yes. Okay, so terbinafine is the answer which many students are actually giving right now. Dhanush, Rana, Kaustab, Khetre, Prativa, yes. All of you are very much right. I think you might have watched my previous video, so we will not discuss this much in detail. So nail lacquers are basically nail polish like fluids which will be dispensed just like nail polishes in small containers, glass container. And the examples for these you can remember with the simple mnemonic ACT, amorolfin, cyclopyrox and terbinafine, and these are kept actually in the same increasing concentration, so 5%, 8% and 10%. And not only these, there are two more which you need to remember, two more. They are efinaconazole and tavabarol. So these are the other two nail lacquers which can be used in the case of onychomycosis. And now please try to identify this picture. So these image based questions are also very important. Yes, so if you get any patient who is having these kind of multiple sessile warty lesions, warty word means that their lesions are very rough or pointed, the surface is just like cauliflower like, and these are present on the vulva. On examination they are not, they do not bleed on touch. What is the most likely diagnosis? So these are anogenital warts, which are caused by human papillomaviruses, and the name given to the anogenital warts is Condyloma acuminata. Okay, and there is one more confusing term called as Condyloma lata. So I remember it as Condyloma flata. Can anyone tell me in which infection can we see Condyloma lata lesions? Yes. Yes, anybody? Condyloma lata, it is seen in, yes, very good. So it is seen associated with secondary syphilis. So to be precise, it is secondary syphilis in which we can see Condyloma lata. So these anogenital warts, they are caused by human papillomavirus, and please remember it is there are 150 200 subtypes of human papillomavirus, but out of which subtype 6 and 11, out of which subtype 6 is the most common variety of human papillomavirus associated with anogenital warts. And these are the lesions which can be seen over the coronal sulcus in the case of males, and also frenulum, and also you are able to see these lesions over the glans penis also. And yes, so can anyone tell me what is the this is the description given to these lesions. Can you now tell me what is the diagnosis which we are discussing? Yes, so pearly white dome shaped umbilicated papules are there, which are showing pseudo-Kobner's phenomenon, and if you take a histopath you are able to see intracytoplasmic eosinophilic inclusion bodies called as Henderson-Patterson bodies. Yes, very good. So the answer is Molluscum contagiosum. Molluscum contagiosum. So you are able to see this beautiful, pearly white dome shaped, umbilicated. What does umbilicated mean? Central depression will be there in these papules. Okay, so these are seen in Molluscum contagiosum, which is basically caused by pox virus. And chancroid it is caused by, I hope all of you know this very famous trick, Haemophilus ducrei. Haemophilus ducrei is responsible for causing chancroid. And can anyone try to identify what is the disease which I am showing you here? Yes, over the shaft of the penis, you are able to see some grouped vesicles over erythematous base. Yes, so this is herpes simplex virus 2, which is causing herpes genitalis. Herpes genitalis. Right. Yes, now please try to answer this question. What can be the possible vitamin deficiency responsible for these lesions? See, this is a very, very, stock question, we can say, so many times asked. But still some students are actually giving some odd answers. It's okay, no problem. Yes, very good, Causative. It is Castle's necklace. It is Castle's necklace, and it is due to nascent deficiency, that is B3 deficiency, where you are able to see this photosensitive rash over photo exposed area. So you are able to see some eczematous changes are seen over the face and exposed areas of the neck, that is V area of the neck. Okay, the rest of the body, it is completely normal. So it is also called pellagra, and it is associated with 3 Ds: diarrhea, dementia, and dermatitis. If we do not treat these patients, the final D, which was earlier seen very commonly but not seen nowadays, that is death, can also occur. And not only the Castle's necklace, but there is one more sign which is associated with photosensitive rash over the dorsum of the hands. Can anyone tell me what is this? What is this called as? So just remember, the Avengers Endgame. So if you remember that, then you can answer this question. So what does this appearance, look like to you? What does this look like to you? So that Thanos wears now. What do you call it as? Right. So yes, it is called as gauntlet. Gauntlet sign is also associated with pellagra. Please remember, maybe this could be a potential future question, because maybe examiners got bored by asking always Castle's necklace, so they might ask you something new. And yes, so pellagra, if you remember, along with acrodermatitis enteropathica, then you can remember and relate. So many features are in common. That is, dermatitis and diarrhea are common, but the type of dermatitis in the case of pellagra is photodermatitis. That is, photo-exposed areas will show eczematous changes, whereas acrodermatitis enteropathica, it will show eczematous changes over acral areas and periorifacial areas. And acrodermatitis enteropathica is due to a defect in the zinc absorption. And the third component of acrodermatitis enteropathica, it is loss of scalp hair, that is alopecia. Yes, now please try to answer this question. Yes. Child presents with scaly dry skin since birth. He had a colloidal membrane at birth. So this is the most important clue. There is a history of colloidal membrane at birth. So this is the membrane. This is the membrane which is given here. And these are some of the scales which can be seen at a later date. So what do you think is the answer here? So very good, those who answered it as lamellar ichthyosis, you are all right. So it is lamellar ichthyosis. So few points about the types of ichthyosis. So ichthyosis vulgaris, X-linked ichthyosis and lamellar ichthyosis. So if you observe carefully, I have actually written them. I have actually compared them according to the age wise. So if you see the extreme right, lamellar ichthyosis, the manifestation can be seen from the birth, whereas X-linked ichthyosis, the manifestation can be seen not from the birth but less than 3 months of the age. From that time onwards we can see the manifestations, whereas ichthyosis vulgaris, which is in fact the most common type of ichthyosis, the manifestations will start from after the third month. So from 3 to 12 months we can see the changes on the skin surface. So now coming to lamellar ichthyosis, which is autosomal recessive congenital ichthyosis. So in short we call them as RK, autosomal recessive congenital ichthyosis. So basic defect is transglutaminase. Transglutaminase is defective. That is the reason why skin barrier function is lost and the keratinocyte proliferation is affected. And because of which during the birth itself there is going to be a membrane called as colloidal membrane which will encircle the entire body. And these children, because of this membrane, because of the tension, they are going to have the ectropion and eclabion as complication. That is, the eyes, they don't close properly, and also the mouth, it can't be closed properly. Okay. Yes. Now, can anyone tell me what is the another skin disease which is associated with antibodies produced against transglutaminase? Yes. Anybody? Can you remember? So I will just give you a clue. It is associated with vesiculobullous disorder. It is associated with vesiculobullous disorder. Yes, Dhanush, very good. So it is dermatitis herpetiformis. Can you tell me what is the exact type of transglutaminase? So in the skin, it is transglutaminase 3. Okay, so that is what is affected in dermatitis herpetiformis. Now, can you please try to answer this question? A 35-year farmer presented with a black mole on the cheek. It increased in size more than 6 millimeters with sharply defined borders with central black lesion. What is the most likely diagnosis for this case? So, from the options, we can understand that it is a case of melanoma. Why? Because A, B, C, D, E, these features are being explained actually in the question. So you can see the diameter is more than 6 millimeters and there is some evolution which is happening in this lesion. That is, the color changes, the central color is becoming more blacker, so color variations is also seen, and borders are also becoming changed. There is a well definition happening, and in the question if you see carefully, there is a black mole on the cheek, and this black mole is slowly, it is transforming. So whenever a question mentions that there was a previous mole which is now showing this A, B, C, D, E changes, always you should think about the most common variety of malignant melanoma, that is superficial spreading melanoma. So Sharadraj Pillai is asking what is a Harlequin baby. So Harlequin is a very very severe type of ichthyosis. Harlequin is a very very severe type of ichthyosis which is due to ABCA12 gene mutation, ABCA12 gene mutation, and I have not kept a picture, but if you see the picture, the scales of these newborn, in the newborn stage itself there will be scales, and these scales will look like something, the child has put up some armor, coat of armor, like scales will be there, and most of the time these children are going to succumb due to various infections or due to thermoregulatory abnormalities. So mortality is very very high in these children. Okay, the picture I have actually put up in the group, so you can check out the derma group. Okay, not compatible with life. Yes. And yes, it is a autosomal recessive, it is a autosomal recessively inherited condition. Yes, and here it is there actually. Yeah, this actually includes Harlequin. So here you are able to see autosomal recessive congenital ichthyosis are these ones. So lamellar ichthyosis, congenital ichthyosiform erythroderma. Okay, so these are all autosomal recessively inherited conditions. Yes, this is a very straightforward question. Which of the following does not cause urethritis in the males? Yes, now please try to answer this question. No, answer was B, not because it is the most common variety, but whenever there is a history mentioning that there was a previous mole which is now transforming into melanoma like features, then you should think about superficial spreading melanoma. Why? Because superficial spreading melanoma, it is associated more commonly with pre-existing mole getting transformed into a melanoma. Okay, that is the reason why it is answered. Not compatible, yeah, that we have seen already. And yes, so I can see some students are giving option B as the answer. So please remember, here the answer is A, option A, Haemophilus ducreyi, which is only and only going to cause genital ulcer disease, that is chancroid. Okay, please remember, it is not going to cause urethritis in males. No, it does not cause. So there are two types of urethritis. One is gonococcal urethritis and the other one is non-gonococcal urethritis. So option C and D, you do not have any doubts. So this is going to cause gonococcal urethritis, and chlamydia trachomatis, it is in fact the most common cause for non-gonococcal urethritis. So that is the reason nobody answered C and D. But Trichomonas vaginalis, not this non-gonococcal urethritis. It is a very broad umbrella term in which many organisms can be the causative organisms, out of which Trichomonas vaginalis is also one of them. And not only that, Mycoplasma, Ureaplasma, Urealyticum, there are many other microorganisms which you must focus upon. Yes, which of the following is a causative agent of Donovanosis? Donovanosis. Yes, can you tell me what is the causative agent of Donovanosis? Yes. Okay, so great. Everybody knows the answer. Klebsiella granulomatis, which was previously called as Calymatobacter granulomatis. So it was earlier called with this name, Calymatobacter granulomatis. Okay, so yes, Klebsiella granulomatis, and here we can most likely see a single ulcer can be noted. And the characteristic of this ulcer is it is going to be beefy red ulcer, which will bleed very easily on touch. Bleeds on touch. And this bleeds on touch characteristic is not only a patent or trademark of Donovanosis. This can also be seen associated with chancroid. A simple trick to remember this is the name of the organism causing chancroid is Haemophilus. So it will love blood. So that is the reason why it can cause the ulcer to bleed on touch. Haemophilus ducreyi. And of course this Klebsiella granulomatis. Okay, and if we do a crust smear, we can see these Donovan bodies as bipolar staining, safety pin like appearing structures. Okay, safety pin appearance, this is also very important for this was actually asked recently. So okay, please remember that along with plague causing Yersinia pestis, even Calymatobacterium granulomatis also can show this. Yes, now please try to answer this. A 1-year-old child has eczematous lesions over the face as given in the pic. His mother has history of bronchial asthma. So what is the diagnosis which you are going to think about? Right. Yes, do cry. Right. Makes you cry. Right. Yeah, Gaurav, it is going to be a painless ulcer in the case of Donovanosis. Right. Yes, most of students have answered. It is atopic dermatitis. Atopic dermatitis, very, very important. Few points which you must know. Investigation of choice is clinical examination, and the criteria which is used is Hanif-Rajka criteria, where pruritus is the most important major criteria which must be fulfilled. Okay, the rest of the things are morphology and distribution, and there should be a chronicity and recurrence history, and also personal or family history. Personal or family history also will be mentioned. Bronchial asthma, wool intolerance, food intolerance, or presence of wheezing, or usage of steroids. So all this will be mentioned in the question. So now please try to answer this question. Velvety hyperpigmentation is seen on flexural area of the person suffering from diabetes. What is your diagnosis? Yes, very good. So it is indeed Acanthosis nigricans. Acanthosis nigricans is going to show this velvety kind of hyperpigmentation, mainly over the intertriginous areas, that is neck folds and axilla, and it is most commonly associated with obesity even more than diabetes mellitus. Okay, this is important point to remember. And this can not only be seen associated with obesity, but also malignancy can cause this velvety hyperpigmentation, and the most common malignancy is GI related, that is gastric adenocarcinoma. And erythrasma, it is due to Corynebacterium minutissimum, whereby we can see this asymptomatic hyperpigmentation present in the axilla and groin. And Becker's nevus, it is the acquired nevus which manifests itself from the time of the puberty, where we can see a brownish hyperpigmentation over which there is going to be a growth of the hair. So hyperpigmentation and hypertrichosis both will be seen in these patients. And this is a very simple straightforward question. I have already discussed this. So it is herpes zoster, where we can see multiple painful blisters present over erythematous base arranged in a dermatomal fashion. Okay, this is very, very easy picture. And just remember that the most common dermatome which is associated with thoracic dermatome, and the least common dermatome is lumbosacral dermatome. Yes, erythema multiforme, it is seen in erythema multiforme, it is seen in. What do you think is the answer for this? So Sharadraj Pillai is asking nevus of Ito versus Becker's nevus. How can we differentiate? Okay, I will tell after this question. Yes, Akanksha Yadav, you're right actually. So there is one more difference. So nevus of Ito and Becker's nevus. So if you observe carefully, in the Becker's nevus, the color is going to be brownish discoloration of the skin will be there. Whereas in nevus of Ito, this is a dermal melanocytosis along with Mongolian spot, and nevus of Ota, this is the dermal melanocytosis. So because of the Tyndall effect, the color of the skin here will be blue. Okay, so the color is different, and also hair which is present in Becker's nevus, hair will be present in Becker's nevus, whereas hair will be absent in nevus of Ito. Okay, I hope it is clear. And this question, so all of you have answered, most of you have answered it as anti-malarials. Okay, so that is actually a right answer. So please remember erythema multiforme, which will present with special lesions called as target lesions. Target lesions mainly over the extremities, palms and soles, whereby we have three zones: central, duskies or erythematous zone, which can have a papule, vesicle or bulla, followed by a second zone, that is pale edematous zone, followed by a rim of erythema. So this is classical of erythema multiforme, and this is associated with some infections. The most common infection you must remember is herpes simplex infection, and after that there are some drugs which can cause this. So in that, please remember anti-malarials are important to be remembered along with sulfonamides and NSAIDs. Okay, and not only that, some connective tissue disease, for example systemic lupus erythematosus, is also important to be remembered. So now please try to answer this question. This is a very straightforward question. So after you answer this, please try to tell me what could be that agent which is actually causing this particular change over the bindi area of this lady. So nevus of Ito and nevus of Otto, it's not Otto actually, it is Ota. So O for nevus of Ota, O for ophthalmology. So in the nevus of Ota, basically the involvement of trigeminal nerves will be there, and if there is ophthalmic involvement, scleral discoloration, bluish discoloration can be noted. Okay, so O for Ota and so O for ophthalmological involvement. You can remember like that. Yes, very good. So anybody, yes. So many of you have given. So it is contact leukoderma due to para-tertiary butyl phenol contact, because of which there is going to be this contact leukoderma. What does contact leukoderma mean? So usually the bindi which many women use, this para-tertiary butyl phenol will be a adhesive which is going to damage and destroy the underlying melanocytes. That is the reason why the skin at these contact sites, only at the contact sites, will become white. So white skin can be seen. That is the reason it is called as contact leukoderma. Contact leukoderma. Or we can also call it chemical leukoderma. Why? Because certain chemicals, they have this melanocyte destroying or damaging effect. And in the rubber, you just remember MBEH. Excuse me, it stands for monobenzyl ether of hydroquinone. Monobenzyl ether of hydroquinone. Yes, very good. Yes, can you please try to answer this question? What do you think is the answer for this? Which of the following statements is false about anatomy of the skin? So you need to identify the false statement out of the following options. Okay, please read the question very carefully. You're not asked to identify the right statement. Yes, yes, yes. Come on, friends. Try to answer this. And one more thing, friends. So if you like this video, yes, while if you like this explanation, please do remember to give a thumbs up for this video, so that both Unacademy as well as YouTube will get to know that these kind of classes, these kind of YouTube classes are actually helpful for the students. Okay, please do drop a thumbs up. Yes, Dr. Prakhar. So not in the comment section. Please do like it in the video. Okay. Yeah. So if you observe, skin weighs about 15 to 18% of the body weight. This is right about the skin. Epidermis is derived from ectoderm and dermis is derived from mesoderm. This statement is also right. Please remember. 90% of the cells in the epidermis are keratinocytes. Yes, this is also right statement. So there are some non-local cells. So actually keratinocytes are the local cells of the epidermis. There are some non-local cells also in the epidermis which are migrant from other areas during the embryogenesis, and out of which Merkel cells, melanocytes and Langerhans cells are important. Okay, Langerhans cells. Option C is the wrong here. Why? Because dermal collagen. So dermis has collagen 1 and 3. This is right till now. And but the ratio is exactly opposite. Okay, you just change the ratio to 8:1, then this option C would have been right. But right now, because 1:8 is given in the option, so option C is wrong. So please remember, collagen 1, it is the most common type of collagen, almost forming 80% of the entire dermal collagen, followed by collagen 3, which is going to be approximately 10% of the entire collagen. Okay, Please remember collagen type 2 is completely absent in the dermis. Collagen type 2 is completely absent in the dermis. Okay, so this Yasin. So yes, this is a very straightforward question. Please try to attempt this question. Yeah, and if you don't like this video, please try to put it in the comment section. What is the actual reason for not liking this video, so that we will sort it out right now in this class itself. Yeah. Yes, very good, Dr. Akanksha. So S for sparing. Okay. So in this question, actually, it is given female patient is coming with history of fever, development of erythematous lesions over the cheeks, and sparing of the nasolabial folds is there. Yes, as rightly told by Dr. Akanksha. So if you see this type of features in a female patient with this beautiful butterfly rash, so the erythematous rash which affects bilateral cheeks and bridge of the nose with sparing of the nasolabial folds, with sparing of these nasolabial folds, these are completely normal. And along with that, there is some systemic symptoms in the form of, there can be mention of fever, of course photophobia is there. Along with that, there can be mention of joint pains, there can be mention of some CNS manifestations. So whenever you see all this, you need to answer it as systemic lupus erythematosus. In the case of dermatomyositis, the nasolabial folds can be involved, nasolabial folds can be involved, and there can be this erythematous rash, which is classically called as malar rash, which is called as malar rash, can be seen in the dermatomyositis also. And if you remember, we have seen in the earlier part of this video, Gottron's papules. Gottron's papules which can be seen as a violaceous macular erythema over the erythema, and also papules over the interphalangeal joint and metacarpophalangeal joint is a pathognomonic sign of dermatomyositis. Okay. Did anyone of you answered melasma or rosacea? No one has answered. Okay, right. So almost all of you know. So let us not waste the time. Yeah, now please try to answer this question. Male, and if you are, yeah, if you have any doubts, any problem identifying how to rule out other options, you can feel free to put it in the comment section. Why am I not discussing is because I just want to cover most of the previous year NEET questions, because they are having very, very high chances to be again repeated. Okay, Naya Dream is telling if you explain all the options, that will be better. So that will be better, but the simple problem is that is going to make this session prolonged one. To click on live again and again. Acha, Ashu Chauhan. Yeah, there are some question. Okay, so was pairing. Was there any question? Yes. Yes, Anurag Chobe, anti-MI2, anti-Jo1 antibodies, they are all seen in dermatomyositis, right? Geographic pitting is seen here only. Okay, so you are able to see these patches of hair loss, which are very smooth, complete patches of hair loss without any signs of inflammation. There are no signs of inflammation, no erythema, scaling, no papules, no pustules, nothing. You are looking as if someone has taken a blade and just tonsured the scalp. Okay, it is looking like that, clean, without any symptoms. So this, if you observe, your diagnosis has to be alopecia areata, and this is associated with pitting of the nails. This is associated with pitting of the nails, and this pitting is called as geometric type of pitting, geometric type of pitting, where as if the pits, that is the depressions on the nails, will appear as if someone has taken a scale and has drawn lines with the help of that scale. So you can see the pits are arranged so much regularly. So this is called as geometric pitting, and these pits are very, very superficial. Why is this important? Because there is one more condition in dermatology called as psoriasis, which is a papilloscomus disorder, in which the pits are going to be having the characteristics of DIC. So what is DIC? The pits are going to be very, very deep in psoriasis. They are going to be very, very irregular, and the nails, they are going to appear very, very coarse. Okay, disseminated intravascular coagulation, DIC. So like that you can remember the features of psoriasis. Deep, irregular and coarse nails will be seen in the case of psoriasis. Okay, exactly opposite to that which are seen in alopecia areata. So exclamation mark hair is seen in. So what do you think is the answer for this? Exclamation mark hair is seen in? Yes, Anurag, trachyonychia is seen in both, right? Sandpaper-like nails. Trachyonychia, right? Trachyonychia, it can also be seen in certain other eczematous conditions. Even in atopic dermatitis, it can be seen. But please remember, alopecia areata is the most common cause for trachyonychia. So exclamation mark hair is again, it is seen in the case of alopecia areata. Okay, please remember this. So what is exclamation mark hair? You are able to see, this is the distal end, this is the distal end of a hair, distal end of a hair, and this is the proximal end of a hair. This is the proximal end of a hair. And what you are able to see, the proximal end is very, very thinned out, and the distal end is very, very broad. So it is, looking like, this exclamation mark like appearance is there. So that is the reason it is called exclamation mark hair. And the reason for this is, if you observe near the hair follicle, most proximal part, we can see this dense peribulbar lymphocytic infiltrate. So this is actually a horizontal section of the skin at the level of the hair bulb. So you are able to see these are the hair bulbs, these are the hair bulbs, these are all the hair bulbs, and adjacent to the hair bulbs, you are able to see that all the lymphocytes, they are forming a swarm of bee-like appearance. These are all the lymphocytic infiltrate. So they are all forming the swarm of bees appearance. So because of these lymphocytes causing this damage, what will happen? The growth of the hair will be halted. That is the reason why proximal part is very, very thin in appearance. Yes, 20-nail dystrophy is trachyonychia, right? Okay, so that is it. So it is almost time, friends. So we will discuss these in the most likely as a short 20 or 30-minute session. I will again put it up in the next month. Okay, so day after tomorrow or something like that. Okay, again I am calling all of you students, if you like this video, please do give it a thumbs up. I can see 57 students are watching and only 32 likes. So it is going to be it is going to be somewhat encouraging if you just hit that like button, thumbs up button, so that I will understand that this class was actually very much helpful. Yes, Kaustubh, thank you so much. Please do hit that thumbs up button also, which is there in this video, and also just scan this QR code, and after this session is completed, and you can join in the 4th September grand test. So I have told you the importance of joining this grand test. So if you have not yet heard, so this is a small small story for those who are attempting the grand test. So this is you who is attempting the grand test, and this is the grand test, actually grand test. So initially it will be very difficult. It will be difficult for you to attempt, and with very frustration, very much self-doubt, you are going to attend this grand test. Then suddenly you will feel, okay, I can do it. Yes, I am doing this grand test very nicely. Then you will start the flow, and suddenly the grantors will start laughing at you, because you are getting the same marks without any increase in the amount of the marks. You are always stuck with some marks which you don't like. You want to increase and go to a good rank. Then at this stage you have to identify what are your strengths, weaknesses, opportunities and threats. So identifying the weakness is the most important thing. Identify the weakness as quickly as possible and do the treatment for these weaknesses, that is revisions. So do the revisions as much as possible and convert the weaknesses into your strengths. Okay. Identifying strengths is also important, because you need to give less time for revisions for your strengths. Okay, don't be rigid. Okay, don't be rigid and in your plans. Why? Because only that which is live can be flexible. After death, our dead body also becomes rigid. So don't be rigid with your plans, be flexible with your plans. Okay, and try to revise only the most weak parts of the subject. Okay, not even entire subjects, weak parts of your subjects, please try to revise them. And if you continue this further, then I hope you all know that the climax is going to be very much happy ending. So that happy ending is the one which will be for us the NEET PG exam day. And okay, after that, if your thoughts are all perfectly aligned, you are also going to get a beautiful results at announcement of the ranks, and also after the counseling process is done. So mind your today's thoughts. Why? Because they are going to become tomorrow's realities. Be very, very careful with what you are thinking of right now, and always have this positive attitude. I can do it, I can do it. And one more thing, if you like these kind of videos, please do download Unacademy app and try to attempt the grant test on 4th September. Okay, the links, all those will be there in the description. Okay, and take a pledge that at the end of the session, I so and so, whatever your name is, you are going to give the best and you are going to achieve a great rank, and also you are going to get the branch and also state which you are going to deserve, and your success is your responsibility. Okay, that is the pledge which you must take. And this is the grantors. Just scan this QR code with the phones. All of your phones will be having. Thanks a lot. Okay, thank you. Okay, yeah. And if you are having any suggestions, any feedback, any comments related to this session, or if anything is needed, please do let me know in the comment section. So Ashu Chauhan, yes, anatomy sucks. Yes, definitely that is there. And for me, even biochemistry used to suck. Yes, definitely there will be some subjects which are weaknesses for individual students. So they have to be well planned for the revision. Okay, revision of those subjects is very, very important. And yes, if you wish to take the plus subscription, with which you are going to get access to both live and recorded sessions of the videos of the educators on Unacademy, and along with that you are going to get printed notes, some quizzes, and top educators, you can learn from all of them. And also there is a question bank which you can also follow, and you can study on device of your choice. So the device can be a tablet or a mobile or a laptop. And if you like prep ladder, you can opt for iconic subscription. And so these are the details of the subscription charges. So all you need to do is just apply DRMSD as your referral code. You are going to get some off. Just scan this QR code. So all of your mobiles will have this scanner. So the app name is Scanner. So with that you can scan these QR codes and you will be redirected directly onto the this app, and use the referral code DRMSD to unlock all the special classes on this app. And for those students those who want to download this class as a PDF, what you can do is, so these are the individual sessions 2020, 2019 and 2018. So all these sessions were taken on Unacademy platform. All you need to do is just download the Unacademy learning app. So download the app. After you download the app, just scan this and you will be redirected to these particular classes. Directly you will be taken to these classes. All you need to do is, there will be one option of watch now, the other option of view PDF and other option of share. So click on this view PDF. There will be two options: download with annotations, without annotations. So click on download with annotations. So the PDF of these NEET PG 2020, NEET PG 2019 and 2018 sessions will be downloaded onto your mobile. You can quickly revise them again. Okay, so I hope it is clear, and if you are having any queries, you can ask me in the comment sections. We can discuss actually if you are having any problem, any queries, any suggestions. And those who are watching this session, and if you are not yet hit that like button, please hit that like button so that it will break. Yes. So that's it in the session, friends. So in the COVID times, these are the new alphabets which we must follow. And this is your dermatology educator, Dr. Maddineni Srinivas. So this is my profile. You can follow my profile so that you will get all the latest updates of the videos which I am going to post. And if in case you are planning to write FMG in the December session, so then I would suggest you to take up at least this 6 months plan. And if you're if you want to complete the FMG, and also after that in the internship, if you want to cover the PG exam also, I would suggest you to take up this 12 months plan. Okay, and finish off all your PG related things. Okay, and if you like to have the prep ladder also, you can take up this iconic subscription. The minimum duration is 12 months for that. Okay, and the subscription charges are all there here. All you need to do is use a referral code DRMSD so that you will get the maximum amount of the discount for the subscription whichever you want to take. So with the subscription, what you are going to get is well structured. So all the batches whatever are there, they are all well planned. Okay, so and they are all live lectures. So in the other apps, the problem is they are all recorded and you might get bored. But in this case, live, because these are live batches, you can ask any of your queries you are having directly to the educators. You can read the day when the class is taken. The next day when the same class is there of the subject, you can ask any queries which you are having. That is the unique point about this Unacademy. Okay, please make use of these live classes so that you are going to cover all your doubts. Okay, so all your doubts will be covered, and doubts are actually the most important reason for which students will actually feel very nervous during the end of the year before the exams. Okay, you can preclude all of that by attending these live classes. Recorded classes are also available for those students who are having some different types of study formats. And question bank consists of 25,000 plus clinical type of questions. And if I have prep ladder subscription, so Dr. Ashu Chauhan, so already if prep ladder is there, then you can take up just the Unacademy subscription, that is a plus subscription. Okay, if you have Unacademy and if you wish to take additional prep ladder, then you can opt for iconic subscription. Then you can opt for iconic subscription. Just select iconic, then the amount of Unacademy and prep ladder together which you are taking will be adjusted, and the only the prep ladder amount is going to be added on to your subscription charges. Okay. And these are the other offers. So if you take up this 1 year offer, you are going to get a 2 months of subscription, which is free, and a 4 year subscription is also there right now. So the actual charges of the iconic subscription, it is very cheap. And if you're second year or third year, you plan to take 4 year subscription, but otherwise I would not suggest you to take up this 4 years subscription. If you are a senior, or if you are having any sibling, so please you can advise them to take up this 4 year subscription with either Unacademy alone or Unacademy and Prep Ladder put together, that is iconic subscription. Okay. Yes. So these are all the QR codes which you can scan, and yes, so please follow social distancing, mask and sanitization. Be very careful. Be very careful. You might have taken vaccination, and do let your parents, friends, near and dear ones also let take all these measures, which are very important right now, even more than actually our exams. Okay. And happy learning dermatology. Yes, I can see any other queries coming up. If you have any other queries related to anything related to dermatology or preparation, you can put it in the comment section in the live chat. So I am just watching the live chat. So 1 or 2 minutes, we will call it a day. So thanks a lot, friends. So if you haven't hit the like button, please do hit the like button. So happy learning dermatology. Sarve jana sukhino bhavantu. Thank you so much for watching with all the patience. And again, I'm trying to remind you. So have good thoughts, so that your tomorrow, which is going to become the reality, is going to be a beautiful tomorrow. Okay. Always have this positive attitude. I can do it. Bye bye. Sarve jana sukhino.